Hi everyone, my name is Kim and I am a certified progressive care nurse. I have a question to pose for you. Do you think that risk assessment, education, and medication disposal programs reduce opioid misuse and accidental overdose in the community? I'm talking prevention here, not the reactive things that are popular now, including methadone and naloxone. Think about it while you step into my time machine, and we're going to go back to way back 2001. Back to that time of Brad and Jen, Ocean's 11, the first iPod, Dido, and then there was 9/11, and our friend, the Joint Commission, declared pain the fifth vital sign, which interestingly followed a barrage of advertising and marketing done by the drug companies, touting opioid pain medication as safe. And then by 2007, we've had the full-blown epidemic. So what's being done? I've seen some changes, in fact, witnessed an evolution in pain management over the past 5 years. This effort's been driven by anesthesia. They've been using blocks, multimodals, pre-meds, and local to minimize that acute post-surgical pain, but not effective enough. So, hence, my PICO question. What else can be done? We have 116 people a day dying of an overdose. So we're going to begin with some research. We're going to use some online databases, and we're going to set some keywords, which mostly surround around opioid crisis, education, the nurse's role, the patient, misuse, abuse, and the like. Thousands of articles came up, so we had to put in some limiters. Limiters were the article had to be 2015 or newer. They needed to be free, full text, peer-reviewed, and in a nursing journal. There were thousands of articles. I read abstracts and reduced them down. I eventually downloaded 18 articles, then narrowed it down to 9, and then I went with the best 6 to relay this evidence. The level of evidence is overwhelming, emphasizing the opioid epidemic. However, answers to the problem currently are reactive. Lack of designated studies and fractured interventions make data supporting the solution unclear. More research is needed with education and public awareness efforts. However, all the information did agree on the scope of the problem. That being 191 opioid prescriptions are dispensed every year. Over 2 million people in the U.S. alone are addicted to prescription opioid medication. Children under the age of 18 are most likely to be introduced to opioids in their own home, and 70% of heroin addicts say they started on prescription opioid pain medication. That gives us a big dollar figure and an economic burden of $78.5 billion. Yikes. So again, what is being done? There's a whole bunch of entities that are working on the problem at different levels, and we still have a problem. Well, why? It's complex. The research positioned the opioid crisis as a complex problem affecting millions of people, social systems, economics, and population health worldwide. It's complex, multi-pronged, multi-leveled, coming from the highest of government legislation down to the single person, the nurse and the patient. So it can be done at a nursing level, more than you think. There's a lot of opportunity here. Let's think about what we do as nurses. We assess risk, progress, pain. We're assessing which is the right med to give for the type of pain. We can reduce. Use different strategies for pain relief, non-pharmacological, non-opioid. We can monitor, pass information on during shift report. When was the last pain med given? How much? How frequent? Work to stretching out those doses. We're a voice in the community, and believe it or not, this starts at the bedside when you're educating your patient about the risk of opioids. Ask them if they have kids, throw out some numbers. We also have a place setting these guidelines. Nurses are in a very unique position to become a part of research teams and bring legislation to the table. And finally, we can educate, not just the patients. We as nurses need to be educated about opioids and their risks. That is one thing that was highlighted in several of the studies. In general, unless working in a surgical or an acute surgical area, nurses don't really have a full grasp of opioid use and the opioid risk. Knowledge is power. We have the power, we are awesome nurses, and we can change the world. Now, would everybody go home and do me a favor and clean out your medicine cabinet? Thanks for listening.